Hi, Simon Smell at GI.healthcare. I'm going to talk today about prebiotics, probiotics, and possibly a little about postbiotics. And I'm going to tell you a little bit about what they all are and what they mean. There is also a new class called symbiotics, which are essentially things which encourage the growth of probiotics, which are given together with the probiotic. So I'm not going to mention those today. So prebiotics. So these are things which encourage the growth of healthy bacteria or bacteria which have health benefits. There are some which now have some reasonable trial evidence. One of the challenges historically has been that things that tend to encourage the growth of bacteria in your large bowel are often things which may also provoke symptoms, so FODMAPs, strangely enough. They may certainly increase microbial diversity, and they may exacerbate symptoms where they are FODMAPs of IBS. However, a number of fibres, particularly soluble fibre like oat fibre, linseed and sun fibre, which is a commercially marketed product, are effectively not unlikely to cause symptoms, but do influence the consistency of the stool. So they definitely have positive effects, probably in part because of their prebiotic properties. There is more work to be done in this field, certainly much less published than in probiotics, which is where I'm moving next. So in looking at which probiotic to take, there needs to be a probiotic that gets as far as the colon, and it needs to get to the colon in sufficient numbers that it's not completely diluted by the 10 trillion other bugs that are there. It may not need to be in vast numbers, because sometimes a small number of bugs can have a big effect, but they certainly need to survive to get there, and in sufficient numbers to make a difference. And they need to stay in the bowel for long enough to have an effect. And in general, although there are one or two bugs that have been shown to embed in the mucus of the colon, in that colonic wall, in general, they disappear, the effects of probiotics disappear within 10 days to a fortnight of stopping the probiotics. Probiotics may have a number of effects. So they may reduce the production of gas, and there's a company at the moment looking at a study for a bug that effectively consumes excess methane, so that may reduce bloating. There is some evidence that one or two bugs may reduce inflammation and gut permeability, and that's important because that may have effects on gut sensitivity, and that leads on to gut sensation, of course. And there are certainly bugs which reduce sensitivity within the gut. There are some bugs which may improve the processing of sensation within the central nervous system, and there are certainly bugs which improve resilience in people with anxiety, and associated anxiety is common in people with irritable bowel syndrome. So this is an area where there's much excitement, and because bugs are not drugs, it's difficult, therefore, to get exclusivity in terms of their use, and they can be copied, not easily, it has to be said, and therefore there are challenges for those investing in this area, because they may not be able to get the proofs or the licenses that a medical therapy or a conventional drug might be able to get. So postbiotics are biochemical products of bacterial metabolism that have positive health effects. So essentially they're the things that the probiotics are making. So a prebiotic is a thing that encourages healthy bacteria to grow. A probiotic is a bug which has health benefits, and it presumably does so by making a metabolic product which is a postbiotic. So effectively it's the product of the bug. And the holy grail, if you like, of the microbiome world, I guess, would be to come up with the metabolic product which one could then market as a drug if one were able to identify and manufacture it. That is an area of research for the future. In conclusion, in regards to managing irritable bowel syndrome, there's often no single trigger, and it's a complex array of interventions that are required because multiple factors combine to lead to disease and symptoms. Treatment of symptoms can be challenging and difficult, and it's important to do the simple stuff first rather than jumping for the latest, most complicated intervention. The biome is probably not the answer to everything, but certainly probably has a significant role in manipulating gut sensation and our interpretation of it. Thanks for listening to the series. Take care, and do subscribe if you wish to our YouTube channel. Bye.